Politicians have been banging the drum of healthcare sustainability for months, suggesting unless we make drastic cuts, we simply will not be able to afford our current healthcare system. While we are told that we cannot afford healthcare, it seems there is one thing we can always afford: more tax cuts.
The White Duncan is cutting almost $5 billion in corporate taxes in the next 3 years, despite Ontario having one of the lowest tax rates in the industrialized world. You know, we need the resources to provide quality services, including healthcare, education, social services.
We have a clear choice in the next election: more tax cuts or healthcare. Healthcare is as sustainable as we want it to be. The Hospital Professionals Division has developed a 5-point platform on how to enhance our present healthcare system. Ontario must stop delisting healthcare by effectively moving services out of hospitals to private user pay settings. Across the province, we have seen hospitals close their outpatient rehab clinics. It has forced many Ontarians to pay out of pocket for physiotherapy.
A two-tiered health system is being created because the only OHIP-funded physiotherapy and occupational therapy clinic in Northumberland is being closed.
I am the face of a physiotherapist patient. Last January I received a total ankle joint replacement and I need 8 weeks of physiotherapy. When I contacted the NHH, I was told to be a 2 to 4 week wait, so I started on a private clinic over in Port Hope, Lakeshore. Well, I finished 2 weeks of physiotherapy over there and I got a bill for $520.
It is far more effective to pay for these services collectively than it is to expect someone who is injured or who has recently faced hip or knee joint replacement to pay out of pocket. It is when they are least able to pay that the system expects them to contribute. This is wrong. We could actually cut our healthcare expenses by bringing drugs, dentistry, and other largely uncovered medical services into the public system. Canada has the second largest private healthcare sector next to the United States. It's time we completed Tommy Douglas's vision and provide public coverage for the kind of health services citizens in other countries take for granted.
Instead of coming to a single location where you can get your blood test done or receive a chest x-ray or even just to see your doctor, the government wants you to go to a private lab site collection or a diagnostic clinic or an urgent care center.
We lost our community lab services. We used to have a partnership with Dynacare and we lost that partnership. We lost evening shift at both sites, the Huntsville site and the Bracebridge site. Now we have one technologist running around trying to do everything on the evening shift. And sometimes we have to call someone in because there just is too much work to do.
As a proportion of healthcare spending, hospitals have been shrinking, and shrinking quite dramatically for about 20 years. So in 1981, hospitals were 52% of the healthcare budget. By last year, hospitals were 37% of the healthcare budget.
Well, I say, Deb Matthews, come to Fort Erie and Port Colborne. You closed my medical beds. You closed my emergency room. You closed my operating room. I do not have maternity. I do not have pediatrics. Deb Matthews, our hospital is closed.
Ontario must recognize that current staff levels are leading to unsustainable workloads that compromise quality care and undermine patient safety. While it has set a target of 70% for full-time nursing, it has set no such target for the more than 200 other professions that are integral to a public hospital.
I'm a medical lab technologist and I analyze and process blood samples, blood specimens, body fluid specimens, tissue. Workload has increased dramatically. We've seen a real rise in not only workload units, but also the complexity of our patients that we process at our hospital. We have a huge regional dialysis clinic here now, a cancer center, and our hospital's probably tripled in size in the last 5 years. And interestingly enough, our number of staff have gone down.
Hospitals already have issues with recruitment and retention. In the next 5 years, we have large groups of our hospital professionals that will be eligible to retire. These groups include pharmacists, medical laboratory technologists, and medical radiation technologists.
Well, the Ontario hospitals, they seem to operate under an incredible veil of secrecy. Information isn't getting out there, and I think that the hospital board meetings should be made public, they should be opened up, and also they should come under the scrutiny of the Ontario Ombudsman's office.
I think there should definitely be a review of CEO salaries. This has been a problem for years and years, that we have felt that CEOs make a lot of money and they move from one hospital to another. They get big buyouts. They don't need to be making this kind of money. The money should be reinvested in our hospitals. I don't think there should be bonuses for CEOs. Healthcare professionals don't make bonuses, and CEOs work in the same environment.
The next election, we need to ask the candidates about these issues. We also need to talk to MPPs now to get their commitment to support a health system that will serve all Ontarians. Put a bumper magnet on your car, wear a button, talk to your friends and neighbors. Our hospitals, our health care is just too special to surrender to private interests.